Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield, Michigan. Another, I would say, educational Facebook Live. As you will see, end block complete, 7/15/25, initials DMC. So as you will see, I removed the excess skin at the bottom, plus the scar, the prominent scar. And as you will see, as I was dissecting, I ran into what are these Ethibond sutures. These green, these are permanent sutures, and they're braided and very thick. And as you will see, the other remnants are right here. And if I pull them, they're relatively very thick, right in the proximity of the implant. And I don't like to see them. As you can see, they're relatively very thick and indeed permanent to prevent this implant from falling. And so all of this foreign material has been removed because you can get some granulation tissue. So this was a grade 4 capsular contracture on the right, painful for the patient. Ethibond suture, anything foreign body removed and done below the muscle. You can see the contracture band. It's kind of like the equator line, if you will. And you can see how it's a little bit compressed. Complete implant capsule removal directly on top of the rib. And now I'm going to go ahead and cut this open. These are implants from 2009 or 2011. So 2011 implants, or 2012. So the patient was not sure. So 2011. So these are 14 or 13-year-old set of implants. So let's see. Again, so very interesting. This is, as soon as I go in, you can see I had no idea that this was the case. So I'm going to cut this open. You can see how thin this capsular tissue is, and to my total surprise, this is indeed ruptured. What I'm going to do is, so to my total surprise, and I'm glad I did the Facebook Live. I just did one in the morning. So below the muscle, very tedious case. You can see how thin the capsule is. I'm going to go ahead and put it here. And so no matter how thin, you have to go in. I'm going to stop right here and you can focus on me. So many people say, why do the end block? Waste of time, too risky, too involved, time consuming. If the end block was not done on this silicone would have spilled into the chest. And no matter how much you clean it up, no much a drain that you put in for a week, 2 or 3 that you see that other patients are getting, you never know that this is a 13-year-old implant, that it is going to be ruptured. And the one and only set, done by a non-board certified plastic surgeon in the proximity of this Ethibond suture. And remember, you never know. So technically in the 13 years, she should have had at least 5 MRIs. And so as you can see, the end block is supreme and key, especially in her, so that you can have none of this spill into the chest. And you can see, look right here. See, and she was in a pain, a severe contracture. And as you can see right here, this is a ruptured implant. And if I go like this, you can see, we will compare this one to that one. That one appears overall grossly reasonably intact. So this is your 400 Mentor implant, and indeed what is not the gummy bear anymore. And completely, what I would say is, it's not completely disintegrated, but it has that consistency, and all contained. Very happy, no masses, nothing, all done and block. And I'm going to go ahead and put this here, and so you can see, look at this. Now I'm going to remove my top glove, so I have a nice sterile pair of gloves for the left side. And you can certainly see that, looking at the many that I removed, this was kind of a recent disintegration, if you will. The left side, end block, complete, gold standard. I'm very happy and content with how the whole dissection has gone. Just by dissecting this one, I felt that this appears to be intact. The right dissection was much more involved and tedious. So you can see there's some fluid around right here. So let me go ahead and, this is where the end block again is key. It's not enough to send. You can see that stickiness, right? And this is that gel bleeding that's occurring. Let me go ahead and get some more, right? So it's leaching out. Gel bleed, it is 100% a known phenomenon when it comes to silicone implants. 400 cc's Mentor intact. So if you look at the difference between this one and this one, you can see the difference. And so this appears a recent disintegration and a capsular tissue that is within normal limits, nothing out of the ordinary. I just want to emphasize here again, this is the capsule. The yellow fatty tissue behind is as much the culprit because it is stopping, and I'm going to go ahead and cut this open. It is stopping that spread of that tissue. And you look at the color of this. She has a lot of inflammation, so this tissue is not good and healthy, and that's why I incorporated it along with the capsule and the implant. So the implants will be returned to the patient, capsules to be sent to pathology, rule out BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. This is a relatively young lady in her early 40s. She absolutely clearly does not need a lift despite her 400. I removed a small excess of skin that certainly helps with the retraction of the pseudo lift. No need for drains, no need for lift, twilight deep sedation, capsules to pathology, cultures for microbiology, high definition pictures and videos of not only what you see here, but most importantly of the chest wall, showing complete removal of the implant capsule with no spillage of the silicone and block the gold standard. She got the twilight deep sedation. And most importantly, we'll see how she does minus the pain on the right side. A young local patient that lives 45 minutes away from here. This is Dr. Khan, Executive Plastic Surgery.